The practice of surgery, with its intricate procedures and precise instruments, is a field that has evolved over millennia. However, many of the surgical tools used by ancient civilizations laid the foundation for the sophisticated instruments employed by modern surgeons today. In this exploration, we will delve into the fascinating world of ancient surgical tools and examine their modern equivalents, revealing the continuity and advancements in the field of surgery. Welcome back to the Zane Facts channel, your go-to source for interesting and informative content on various fields like history, science, archaeology, anthropology, and mysteries. Subscribe to Zane Facts channel, like this video, and comment to connect with us. Don't forget to press the bell icon. Share this video with your friends and family. Scalpels and knives, the cutting edge of surgery. One of the most basic yet essential tools in any surgeon's kit is the scalpel. The ancient Egyptians, Greeks, and Romans all used knives made from obsidian, bronze, and iron for surgical procedures. These early scalpels were often small, with a sharp edge designed to make precise incisions. Obsidian, a volcanic glass, was particularly favored for its sharpness, even surpassing the sharpness of modern steel scalpels in some cases. Today's scalpels are typically made from stainless steel, titanium, or high-grade carbon steel, providing durability and precision. Some modern surgical scalpels even have disposable blades to ensure sterility, a significant advancement from the reusable blades of the past. Forceps, the essential grasping tool. Ancient surgeons used various types of forceps, some designed for general use and others for specific procedures. For instance, the Romans had forceps for removing bone fragments, extracting teeth, and even pulling out polyps. These tools were often made of bronze and designed to apply gentle but firm pressure. Modern forceps come in a wide range of shapes and sizes, each tailored for specific surgical tasks, from grasping delicate tissues to handling needles. Stainless steel is the primary material used, ensuring that the tools are both strong and resistant to corrosion. Trephines and saws, drilling into the skull. Trephination, the practice of drilling or cutting a hole into the skull, was used by ancient cultures to treat conditions like head injuries and relieve intracranial pressure. The Romans used a tool called a trephine, a type of circular saw, to perform these procedures. This tool required skill and precision to avoid damaging the brain tissue beneath. Today, neurosurgeons use advanced drills and saws with precise control mechanisms to perform craniotomies, a procedure that has its roots in ancient trephination. Modern tools are designed to minimize trauma to surrounding tissues, reflecting significant advancements in surgical techniques and understanding of anatomy. Probes and curettes, exploring and cleaning wounds. Probes were essential tools for ancient surgeons, used to explore wounds and deliver medications. Roman probes, often made of bronze, came in various designs, including simple rods and more complex spatula probes. Curettes, on the other hand, were used to scrape away tissue, a practice that remains in use today. Modern probes are made from stainless steel and are often designed with ergonomic handles for better control. Curettes are also widely used in modern surgery, particularly in dermatology and gynecology, where they are employed to remove tissue with minimal damage to surrounding areas. Cautery tools, the power of heat. Cauterization, the practice of using heat to burn tissue and stop bleeding, was common in ancient surgery. The Greeks and Romans used heated metal instruments for this purpose, a technique that, while effective, was extremely painful for the patient. Electrocautery devices are now a staple in modern surgical procedures. These tools use electric currents to generate heat, providing a precise method for cutting tissue and controlling bleeding with minimal discomfort to the patient. Cupping vessels, an ancient therapeutic technique. Cupping was a common practice in ancient medicine, used to draw out toxins and increase blood flow. The Egyptians and Greeks employed cupping vessels made of bronze, glass, or pottery for this purpose. These vessels were heated and then placed on the skin to create suction. Cupping is still practiced today, particularly in alternative medicine, although the tools have evolved. Modern cupping sets are often made of plastic or silicone and use pumps to create suction, making the process more controlled and hygienic. Needles and sutures, stitching up the past. Ancient surgeons used needles made from bone, bronze, or iron to stitch wounds. The sutures were typically made from plant fibers, animal sinews, or even hair. Despite the rudimentary materials, these methods were effective in closing wounds and promoting healing. Modern equivalent surgical needles today are made from high-grade stainless steel and are often curved to allow for easier maneuvering through tissue. Sutures are made from synthetic materials like nylon or absorbable polymers, which reduce the risk of infection and promote better healing. Speculums. Opening the body for inspection. The vaginal speculum, a tool used to open the vaginal canal for examination, was first developed by the Greeks and Romans. Made from bronze, these early speculums were simple yet effective, allowing physicians to diagnose and treat conditions within the female reproductive system. Modern equivalent. Modern speculums are more refined, made from plastic or stainless steel, and are designed for single use in many cases to prevent cross-contamination. The design has also been improved to provide more comfort to the patient. Catheters. Navigating the urinary tract. Ancient catheters, used to relieve urinary retention, were made from metal, with the Greeks and Romans developing various types for different purposes. These tools were essential in treating conditions like bladder stones or urinary obstructions. Modern catheters are made from flexible materials like silicone or latex, making them more comfortable for patients. They are also designed to reduce the risk of infection, a significant concern in ancient times. Bone saws cutting through hard tissue. Bone saws were used by ancient surgeons to amputate limbs or remove bone fragments. The Romans had several designs, including serrated saws that could cut through bone with relative ease. Modern orthopedic saws are powered by electricity or compressed air, providing greater precision and control. They are designed to minimize damage to surrounding tissues, a significant improvement over their ancient counterparts. Hemostatic instruments controlling blood flow. The ancient Romans used various tools to control bleeding during surgery, including clamps and ligatures. These instruments were vital in preventing excessive blood loss, which could be fatal. Hemostatic forceps, also known as clamps, are used in modern surgery to control blood flow by compressing blood vessels. These tools are made from stainless steel and come in various designs to accommodate different surgical needs. The field of surgery has come a long way since the days of ancient Egypt, Greece, and Rome. While the tools used by ancient surgeons were rudimentary by today's standards, they laid the groundwork for many of the instruments and techniques used in modern medicine. The evolution of surgical tools reflects not only advances in technology, but also a deeper understanding of human anatomy and physiology. As we continue to innovate in the field of surgery, it is essential to remember the ancient pioneers whose work has made modern surgical practices possible.